Rock River Valley Blood Center, and I'm with Lisa Entrican, and you're the Director of Operations, but right now you kind of have another title. You're the interim CEO as well.
I am, yes.
Okay, so you're not doing anything. You don't have anything going on.
Not too much, no.
All right, so give us a brief history on the Blood Center.
Well, we've been around for 65 years, so we've been here a long time, and we were formed by the three main hospitals here in Rockford who saw a need to have a full-time blood bank so blood was available for patients.
Okay, so that's been a long time.
A long time.
So I know that everybody is aware, yes, you can donate blood, you can go to blood drives and do a regular donation, but you have a few other services, and one I want to talk about today, and we're standing in front of this machine for a reason, a very specific reason, a platelet donation.
Right. So people know about whole blood. You come in, we tell you it's a little prick, it's a 10-minute donation, and you can save up to 3 lives. But each whole blood donation is separated into different components. You have a red cell, a plasma, and then a platelet. And the issue with the platelets is such a small part of the actual whole blood donation that to give a patient a therapeutic dose, it takes 6 to 10 whole blood donors just to make one dose for a patient. And so you're exposing a patient to 6 to 10 people for potential harmful things. So with a platelet donation, somebody comes in and they're on a piece of equipment called an apheresis machine, and we're able to separate out just their platelets and return their red cells and their plasma to them. The donation does take longer, but in the end, we get a dose that's good for one patient.
So it's everything all inclusive right in there, and it's what they need. So why is this needed? Who needs a platelet donation?
So platelets are used in cancer treatment. Platelets are used when somebody is bleeding and it helps their blood clot. So that's why
I was going to say, is that why it's moving behind us?
That's why the machine is moving. So we want to keep them agitated because once they stop moving, they stick together. So once that product is transfused, they're gonna cup together and then they're gonna help blood clot.
Is there an ideal person for this?
Actually, anybody is a good platelet donor. All blood types are needed. We do have an issue if you're a female and you've had pregnancies in the past. We do test you to make sure that you don't have a certain antibody. But otherwise, anybody's eligible. All blood types are needed.
Okay, so let's take a look at. Can we take a look at a bag?
Absolutely. So this is a platelet, and it is milky looking. But yeah, this is one dose. And to donate just this much of your platelets could be anywhere from 60 minutes to 90 minutes.
So a little bit longer.
Does take a little bit longer, but so they're separating this out of your blood, and then we're collecting it, and you're getting the other stuff back. Now, the other neat thing about platelets is you can actually donate every 7 days. With whole blood, your red cells, it takes a lot longer for you to recover, so it's every 56 days. But your platelets are replenished so fast, you can be a platelet donor every 7 days.
That's pretty cool. It looks like melted butter.
It does.
Which is good as well.
Yeah.
Okay, so being in here, because you said that they will clot, how long will this last?
So these products, that's the other tricky thing about platelets. A red cell is good for 42 days. So once you donate, we can put it on the shelf and we have over a month to use it. Your plasma we can freeze, and that's good for up to a year. But these guys here, 5 days. So that's why platelet donors are so incredibly important. They're dedicated people. They sit and they're with us for a long time, and their product's only good for 5 days.
I think I've actually seen a couple people doing that when I've come in to donate, that they have headphones on, they're watching TV, they're tucked in, like they're here for a little while.
And we take good care of you.
Okay, so let's put this back so it can keep moving. I mean, we only have 5 days of it, so we want to make it last. There's other donations that you do as well, and I know there's a stigma behind stem cell donations because people think it's very invasive, the recovery time is long, but there's an easier way.
Sure. So if somebody needs a bone marrow transplant, years ago the only way to get that was to take the donor into the hospital and to stick a big old needle in their hip bone and to get their bone marrow out, and that was how the transplant went. Well, with technology today, we're able to collect your stem cells through your blood. So we have staff here who are amazing, and the donor comes in. Now that is a very long procedure, could be 3 to 4 hours that they are hooked up and processed, but we take very good care of them as well, and it's just amazing. you're picked for a specific patient. You're a perfect match. So
Right.
you know specifically that the minute your donation is done, it could be flown anywhere in the world. We have patients in Germany, here in the States. It just depends on
Wow.
where it could go. And then you're saving specifically one person's life with your
So
your
that's
stem
that's
cell.
at bethematch.org, correct?
Yes, yes.
It is so easy to donate, and I always ask everybody, why do they donate? I mean, for me, it's a great way to give back to your community,
It
and
is.
it takes almost maybe an hour.
Maybe.
Depends on how long you hang out or how long it takes to get through the paperwork. So it's very, very easy.
It is fast.
If you want to know, you can always ask me.
She's a donor.
I'm a donor. So they have a lot of other programs and services. And where would they get all the information about you?
You can get it right on our website, rrbbc.org.
And all your drives and everything listed right
Everything's
there?
listed. You can even make an appointment online, whether for a blood drive or at one of our sites.
Well, that's even easier. People are
Right.
busy.
I
That's
know.
kind of nice.
It is nice.
Thanks, Lisa.
You're welcome.
I had no idea all those services were available. What I did know is that it's birthday time. Turning 51 today, TV chef Rachel Ray. Tomorrow, comedian John Mulaney turns 37. Also tomorrow, are you ready to feel old? Macaulay Culkin is going to be 39. Wednesday, Brandon Walsh from 90210, Jason Priestley, turns 50. And lastly, Rockford's own Emily Bear turns 18 on Friday. Happy birthday.